Hello dear learners, I am Dr. Ganesh Andale. In this video, I will discuss about the anxiolytic, sedative and hypnotic agents which are the CNS depressant agents. Let's have a quick glance on the learning outcomes. After watching this video, learners will be able to describe anxiolytic, sedative and hypnotics, classify sedative and hypnotics, list the important drugs used for anxiolysis, sedation, and hypnosis, and explain the mechanism of action of benzodiazepines. Now, moving on to the next slide, let's discuss about the anxiolytics. These are the drugs which are used in the treatment of anxiety disorders, which are characterized by excessive or inappropriate anxiety. So, in case of the excessive or the inappropriate anxiety, the anxiolytics are used. Anxiolytics are mainly act by relaxing the skeletal muscle, and most of the anxiolytics possesses sedative properties. Benzodiazepines are most widely used anxiolytics because of lesser toxicity and higher clinical effectiveness. They are also called as tensiolytics and minor tranquilizers as they produce a calming effect by relieving anxiety and tension. Anxiolytics gives the calming effect by relieving anxiety and tension. Hence, they are also called as the tensiolytics and the minor tranquilizers. Now moving on to the next slide, let's discuss about the sedatives and hypnotics. So let's discuss about sedatives. These are non-selective general depressants of the CNS. So sedatives are also CNS depressants that reduce restlessness and emotional tension without producing sleep. Hypnotics are the CNS depressants that produce sleep to reduce restlessness and emotional tension. So hypnotics will produce the sleep, whereas sedatives, they reduce the restlessness and emotional tension without producing sleep. Now the time to reflect. Now let's consider this question. What's the difference between anxiolytics, sedative and hypnotics? Now pause the video and note down the answer in your notebook. Once you finish with your answers, then play the videos. Yes, now we will consider the answer you wrote in your notebook. And effective anxiolytic agents should reduce anxiety and exert a calming effect. Sedatives are CNS depressant that reduces the excitement, calms the patient without inducing a sleep. Whereas hypnotics are the substances which produces sleep which resembles to the natural sleep. These all phenomenon are dose dependent, that is, anxiolytics in higher doses produces sedative effect, sedatives on higher doses produces hypnotic effect, and hypnotics in higher doses produces general anesthesia. So this is the major difference between anxiolytics, sedatives and hypnotics. Now let's see the classification of anxiolytic, sedative and hypnotics. Chemically, they are classified mainly into the three classes. The first class is benzodiazepines, which includes the example as chlordiazepoxide, diazepam, oxazepam, clorazepam, lorazepam, flurazepam, and alprazolam. The second class is barbiturates, which is classified further into the four subclasses based on their duration of action and the onset of action. The first class is long-acting agents, whose onset of action is of 30 to 60 minutes and duration of action is of 6 to 8 hours. Example includes barbital, phenobarbital and methabarbital. Second class is intermediate acting, that is onset of action of 15 to 30 minutes and duration of action is of 4 to 6 hours. The example includes amobarbital and butabarbital. The third class of the barbiturate is short-acting barbiturates whose onset of action is 10 to 15 minutes and have a duration of action of 2 to 4 hours. The example includes the secobarbital and pentobarbital. The fourth class of the barbiturate is ultra short acting barbiturates whose onset of action is of 0 to 45 seconds and duration of action is 15 minutes to 3 hours. Example includes the thiophental sodium, hexobarbital, methohexital. The third class is the miscellaneous agents, which is further classified into the three subclasses. The first class is amides and imides. Example includes glutathione, methylprednisolone, and methacpalone. Second class is alcohol and their carbamate derivatives. Example includes the ethchlorvinol, ethenamate, and meprobamate. The third class includes the aldehyde and their derivatives. Example includes the chloral hydrate and paraldehyde. Now let's consider the benzodiazepines and related compounds. So this is the structure of benzodiazepines where azepine ring is attached to the benzene. In the benzodiazepines, at the first position and at the fourth position there are the two nitrogens, hence these benzodiazepines are also called as the 1,4-benzodiazepines. Benzodiazepines binds to a benzodiazepine recognition site, one of the several allosteric sites that modulate the effect of GABA binding to a GABA A receptor. So the GABA is nothing but the gamma aminobutyric acid. Now let's discuss in detail the mechanism of action of benzodiazepines. Benzodiazepines work by increasing the efficiency of a natural brain chemical, that is GABA, to decrease the excitability of neurons. GABA is the gamma aminobutyric acid, which is also considered as the inhibitory neurotransmitters. This is the transverse section of the GABA receptor where you can see the presence of the GABA site, benzodiazepine site, and in the center there is a opening for the chloride ions. The effect of benzodiazepine is to enhance the response to GABA by facilitating the opening of GABA activated chloride channel. So basically, benzodiazepines, when binds to the benzodiazepine site, they make the allosteric changes on the GABA site and allows the opening of the chloride ion channels. Benzodiazepine binds specifically to a regulatory site on the receptor distinct from the GABA binding site and enhanced the receptor affinity for GABA. This is the flow chart. This is how the barbiturates or the benzodiazepine shows their action as an CNS depressant. So in the first step, the barbiturates or the benzodiazepines will go and bind to a GABA A receptor at different allosteric sites. So benzodiazepines or the barbiturates bind to their respective site, which is called as the allosteric sites. So what they do is they facilitates the GABA action. They facilitates the binding of GABA on the GABA binding site. So which basically opens the chloride ion channels. When GABA, that is gamma aminobutyric acid, binds to the GABA binding site, which opens the chloride ion channels. Okay, so barbiturates increase duration and benzodiazepine increases frequency of opening of chloride channels. This will leads to the membrane hyperpolarization because of the more number of chloride ions inside the cell, and which leads to the CNS depressant. That is the action of the anxiolytics, sedatives and hypnotics, that they makes the CNS depressant action. Thank you so much.